This video has been provided by the Home Infusion CLABSI Prevention Collaborative. Thank you in advance for watching this video. This video shows a patient and a caregiver, such as a family member, friend, or neighbor, working together. This video will be presented in 11 sections. Section 1, Introduction. Section 2, How to get started. Section 3, Hand hygiene. Section 4, Prepare a clean workspace. Section 5, Gather supplies. Section 6, Prepare supplies. Section 7, Spiking the bag. Section 8, Priming the tubing. Section 9, Pulse flush. Section 10, Ready to connect. Section 11, Disconnect and flush. Section 1, Introduction. First, we will go through the introduction. Your medical provider has prescribed an IV medication that you can safely administer in your home. The procedure and steps to follow will be provided in this video. The medication will be infused with an IV and an IV pole. Please ask your home health nurse, infusion pharmacist, or doctor for specific instructions, as some of these steps may or may not apply to you. Please watch this video as many times as you need. If you have a caregiver or family member assisting you, please have them watch this as well. Section 2, How to get started. Your nurse will go over your provider's orders for your flow-regulated infusion. The first thing to think through is the timing of the infusion. You may need to take the medication out of the refrigerator in advance. Your home health nurse will tell you how far in advance you should take the medication out. This will allow the medication to return to room temperature. If you forget to remove the bag prior to starting, it will not cause you any harm, but you may feel chilled during the infusion and it will take longer. Do not attempt to warm up the bag. Section 3, Hand hygiene. Now, let's talk about the most important step, hand hygiene. Practice good hand washing. Washing your hands helps reduce your chance of infection. Use soap and water at first. Make it a habit to wet your hands, apply soap until lathered, and then scrub your hands for at least 20 seconds. To make sure you are taking 20 seconds, sing the happy birthday song twice. Then dry with a clean paper towel. You can use hand sanitizer after you've already washed your hands with soap and water. If you use hand sanitizer provided by your healthcare team, rub a nickel-sized amount between all parts of your hands using friction for at least 20 seconds until they are dry. Never wave or blow on your hands to speed up drying. Even if you are using gloves, you must still wash your hands. If your nurse tells you to use gloves, put your gloves on after washing your hands. Section 4, Prepare a clean workspace. Now it's time to prepare a clean workspace. Before each infusion, find a clean, dry, hard work surface to set up your medication and supplies. If your nurse gave you a SAS or SASH placemat, put this mat on top of the work surface. Clean the workspace, including the SAS or SASH mat, with a gentle cleaning solution, such as a disinfectant spray, or with alcohol pads. Wash your hands like you did before. Section 5, Gather supplies. Your home infusion agency will provide you with these supplies. If you are missing any supplies, contact your home infusion agency. You will need 2 saline syringes, 1 heparin syringe if prescribed, 1 medication bag, 1 flow regulator tubing set, 1 red cap, 5 to 10 alcohol pads to clean your supplies and hub or IV line tip, 1 IV pole, 1 trash bag, such as a small grocery bag, 1 sharps container. Double check your medication. Compare the information on the bag to your orders and make sure it is the same. Does the medication have your name and date of birth? Is the medication name correct? Is the medication amount correct? Is the medication expired? Is it an IV medication? Does it have the right time listed? If any of this information is wrong or the medication is expired, stop. Do not start the infusion. Call your home infusion pharmacist immediately. Section 6, Prepare supplies. Now let's prepare your supplies. Wash your hands as you did before. Now, prepare your supplies. First, place the alcohol pads in the 2 saline syringes on the SAS or SASH mat. Unwrap the saline syringes and place them on the first and second S of the SAS or SASH mat. If your provider has ordered heparin, unwrap the heparin syringe and place it on the H. Most patients do not need heparin. If your medication or medication bag is in a plastic bag, remove it from the plastic bag. Place the unwrapped medication and medication bag above the A on your mat. Locate the tubing and remove it from the wrapping. Remove the tape and the clip from the tubing. Move the clear plastic wrapping to the side. Place the cap by the A on the SAS or SASH mat. Place the trash bag close by and the sharps container within your reach. Place the IV pole next to you. Make sure it is at its full height. Wash your hands as you did before. Section 7. Spiking the bag. You are ready to attach the tubing to the medicine bag. Close the clamp and open the flow regulator. Pull the protective tab off the medicine bag. Do not put it down. Continue to grip the bag at the entrance site. Pick up the tubing with your other hand while taking off the clear protective cap over the tubing spike. Now, insert the spike into the medication bag where you just pulled off the tab. You will use a push and twist motion. You will know the bag is spiked correctly when you see the tip of the spike in the bag. Awesome! You have successfully spiked your bag. Section 8. Priming your medication tubing. Now it is time to prime your tubing. To prime means that we need to make sure that the fluid runs through the tubing and all the air is eliminated. Wash or sanitize your hands as you did before. Hang the medication bag on the fully extended IV pole. Then, squeeze the drip chamber until it is half full. Find the clamp on the tubing. Open the clamp. Open the flow regulator. Watch the fluid as it runs through the tubing. When the fluid has reached the end of the tubing, you will notice a few drips coming out of the end of the tubing. Close the clamp to stop the flow. Look at the tubing to make sure the priming worked. Make sure you see no large air bubbles. Some small bubbles, like the fizz in a soda can, are okay. If you see large air bubbles, open the clamp to start the flow and watch the fluid and the air bubble flow out of the tubing. Call your nurse if you have any questions about whether you have primed the tubing correctly. Now, keep the clamp on the tubing closed until you are ready to infuse. Section 9. Pulse flush. You are almost ready to connect, but first, we must flush the IV line with saline. Wash your hands again. You will need to get rid of the air bubbles in the syringe. Loosen the syringe cap, but do not take it off of the syringe. Hold the syringe with the end up and plunger at the bottom. Pull back on the syringe plunger slightly to break the seal on the syringe. You will be able to see the tiny air bubble in the syringe. Slowly push the plunger up to let that tiny air bubble out without pushing off the cap. If the cap falls off, you will have to start again. Tighten the cap back on the syringe. Once the air is removed, you are ready to flush the IV line with saline. Keep holding onto the syringe. Don't let the tip of the syringe touch anything. If you do, stop and get a new one. With an alcohol wipe, scrub the end cap of your IV line or the hub for at least 15 seconds using friction. This is scrubbing the hub. Do not let the end cap or needleless connector touch anything and do not touch it. If you do, you will have to scrub the hub again. Discard the alcohol pad. Remove the cap from the saline syringe. Attach the saline syringe to the center of the hub and push and turn clockwise until attached, just like turning the key in the ignition. Be sure to unclamp any clamps on your catheter. Now, use the push-pause or pulse flush method. Push 1 milliliter of fluid, pause, push another milliliter of fluid, pause, and keep going until the syringe is empty. Remove the syringe. If it is difficult to flush, check to make sure that the clamps are unclamped and try again. If you are still having trouble, contact your infusion provider. Section 10. Ready to connect. Now you are at the A, or administer. You are ready to connect. First, wash your hands. Before you open your clamps, you want to make sure that your IV pole is extended fully and that your IV bag stays above the level of your heart during the infusion. With an alcohol wipe, scrub the end cap of your IV line or the hub for at least 15 seconds using friction. Get the edges and the top. This is scrubbing the hub. Take the tip of the medication tubing and attach it to your IV line by twisting. Turn the flow regulator so that it matches the rate on your orders. Now, go ahead and open the clamp on your IV line and on the tubing. You should see the medication drips through the drip chamber. Continue to monitor your infusion for completion. Section 11. Disconnect and flush. When your IV bag is empty and the drip chamber is half full, that means your infusion is complete. Now, close the clamp on the IV tubing. Remember, you can use the same tubing for up to 24 hours unless your nurse tells you to change it more often. If you have another infusion with the same medication later on today, you can reuse this tubing. If you have another infusion later today, you will need a cap. This one is red. First, as always, wash your hands. Close all clamps. Take the cap from the A part of the SAS or sash mat. Twist off the tubing from the needleless connector. Do not remove the needleless connector. Put the cap on the end of the tubing with a twisting motion. Keep the medicine bag on the IV pole. When it is time to prepare the new bag for the next infusion, you will throw out the old bag. Using the saved tubing, you will repeat the process of washing or sanitizing your hands for 20 seconds, spiking a new bag, and repriming the tubing for the new infusion. If it is a new day, you must begin the whole process again with a whole new IV tubing set. Remember, never use the same tubing for 2 different medications. If you do not have another infusion today, you can dispose of the medication bag and the tubing. Wash your hands as you did before. Pick up the saline syringe from the second S on the SAS or sash mat. First, you will need to get rid of the air bubbles in the saline syringe. Loosen the syringe cap, but do not take it off of the syringe. Hold the syringe with the end up and plunger at the bottom. Pull back on the syringe plunger slightly to break the seal on the syringe. You will be able to see the tiny air bubble in the syringe. Slowly push the plunger up to let that tiny air bubble out without pushing off the syringe cap. Tighten the cap back on the syringe. Now scrub the hub. With an alcohol wipe, scrub the end cap of your IV line or the hub for at least 15 seconds using friction. This is scrubbing the hub. Do not let the needleless connector touch anything and do not touch it. If you do, you will have to scrub the hub again. It is now time to pulse flush. Hold the syringe with the end up and plunger at the bottom. Remove the cap. Attach the saline syringe to the center of the hub and push and turn clockwise until attached. Now push 1 to 2 milliliters of fluid at a time using the push-pause or pulse flush method until the saline syringe is empty. Remove and discard the syringe. If your provider has told you to also flush with heparin, scrub the needleless connector again for 15 seconds with a new alcohol pad. Take the heparin syringe. Loosen the syringe cap, but do not take it off of the syringe. Hold the syringe with the end up and plunger at the bottom. Pull back on the syringe plunger slightly to break the seal on the syringe. You will be able to see the tiny air bubble in the syringe. Slowly push the plunger up to let that tiny air bubble out without pushing off the end cap. Tighten the cap back on the syringe. Now scrub the hub. With an alcohol wipe, scrub the end cap of your IV line or the hub for at least 15 seconds using friction. This is scrubbing the hub. Attach the heparin syringe to the center of the hub and push and turn clockwise until attached. Now, push 1 to 2 milliliters of fluid at a time using the push-pause or pulse flush method until the heparin syringe is empty. Remove the syringe. Wash your hands one final time as you did before. You have now infused your medication. If you have any problems with your infusion, call your home infusion provider.